Good morning, everyone. It is about 9:30 on the morning of Sunday, the 22nd of March, and I just thought I would do a quick update on our practice and the coronavirus situation. Um, as I said in previous slides, I'll just give you a quick update on the things you can do to stay safe. So, please, if you have any flu-like symptoms, please isolate yourself at home. If you have any worries, please call us. Advise family and friends to stay away, especially those who are at risk. So, anyone with medical problems or the elderly. Hand washing is one of the most effective and basic things you can do. So, please, lots of soap and water. That is the most effective thing you can do multiple times per day. As I said, try to socially distance yourself and remain at home. And if you're at very high risk, so if you are elderly, if you are immunosuppressed, if you have any medical conditions, please phone us. Do not come in. So, as I said to you before, we are now doing, since Friday, we're doing predominantly telephone consults. We are working to try and move towards video consults. The reason for this is that we have to be able to achieve social distancing in the practice. And the only way we can do that effectively is actually by getting you to stay at home. Because to function as a practice safely, for you, we need social distancing. So if you look at the base layer here, this is how our practice is now functioning. We've had to change things a lot. Obviously, all our lives are changing drastically day by day. So the only way we can achieve safety for everyone, including staff and patients, is safety by social distancing. And what we are doing is we are reallocating our resources, so doctors, nurses, and admin, to best manage things over the phone and by video. And hopefully, by doing this, we can maybe save a few lives. So, what we are asking you to do is any flu like illness, such as or sore throat, cough, fever, please stay at home and call us. Anyone needing prescriptions or phone advice, again, please book a phone consult. If you are unwell at all, please do not come in. Please stay at home. We want you to remain at home as much as possible and just book a telephone consultation. If we need to see you, we will arrange for you to come in and we will see you in full protective gear, such as obviously face mask, gown, gloves. But really, social distancing is the key here. So just to go back to the telehealth for a minute, as I said, we are very much open and here for you. We are working more than usual, and it is business as usual. So what will happen when it is your appointment time? We will call you. Please don't call us. We only have a certain number of phone lines coming into the practice, but we have multiple lines going out. So around your appointment time, just stay by the phone, and we will call you. We may be a little bit late. Obviously, it's some appointments run late, same as if you're in a waiting room. So please just bear with us, and we will call you at your appointment time. So appointments are about 10 to 15 minutes per usual. Be ready with your queries. Write a list and have a list of medications you might need, and the names of them. We are finding, we went telehealth on Friday, and we're finding that it's actually working really well. People have been very grateful for us, grateful to us, for doing it. And the consultations tend to be quite quick. We're probably doing around 8 to 10 minutes. So hopefully, once we get more efficient at it, we'll actually be able to contact more of you than usual, which is a good thing. So as you probably know, about a week ago, Medicare created these item numbers so that we could do telehealth for at-risk groups. So to be eligible for telehealth, you needed to be in the over 70s or over 50 and be of Aboriginal or Torres Strait Islander descent, be pregnant, or be a parent of a child under 12 months, or be under treatment for a chronic health condition or immune compromised, or if you have been advised to isolate or quarantine at home based on the guidelines. Now, to be honest, we are including everybody in telehealth. We are not charging anybody because I think We have decided as a practice, and we know nationwide that a lot of people are going to suffer through this. This is going to be a long road. It's not going to be over in a couple of weeks. Um, People unfortunately are going to lose their jobs. People are going to be hard up for money, and we are doing telehealth with everybody at no charge. So as I said, we're not charging for everyone. The community will be challenged, and we need to support everyone. Um, it's my opinion that more needs to be done, and everybody needs to be included in the telehealth eligibility. So I think it's happening in governments around the world. America, Canada, New Zealand. I think it's only a matter of time before they actually broaden the scope or the eligibility to allow everybody to access telehealth. But for the moment, we're doing it anyway. We're jumping ahead of the curve, because we really want to keep people safe, keep you at home, manage you as much as possible at home, and we'll only bring you in if we really have to. So how can you book online? Well, you can obviously ring us, but obviously our phone lines are pretty busy at the moment. So the best thing you can do is to go on to HotDoc, that's HOTDOC, which is an app or online, and we have changed all the appointments to telehealth. So the only one you can book online is telehealth. So I'll just show you that now. So when you go into HotDoc, obviously select Core Medical, you'll see telehealth phone consult comes up. That's the only one you are allowed to book now online. And if you can select your preferred doctor, or any doctor as we get busy, this is Dr. Monroe's one that's up here. You basically just go in and select telehealth. So as I said, we have removed the criteria for that was quite restrictive there, so anybody can go in and book that now. So as I said before, common questions we're getting about is what do I do if I need a dressing, if I need a vaccination, if I need some other kind of injection, or if we need to manage a warfarin dose with blood tests or pathology. As I said, best thing to do is just make an appointment with us. We will triage you over the phone, and we will arrange for you to come in under strict control if we have to get you in. As I said, safety is paramount here. We are really trying to limit spread in the community. So please be reassured that we still can see you. It's just going to be under very strict control. So a takeaway message is please stay home and just talk to us. Please do not come in. We are all still here for you. We are actually going to be probably more available because, as I said, our appointments are much quicker now with phone consult, so we'll probably be able to fit more in during the day. I'm going to obviously be available more personally, and so will the other doctors. Stay tuned later on today. I'm going to do another video about common myths about coronavirus, things about certification, medical certs, employers, all that kind of thing. So I'll do another post later on today. As I said, if you can please tag people, like this post, share it. I want this to get out as much as possible, and encourage other practices to do the same as what we're doing, just to keep people safe. Okay, thank you, and I will chat to you later. Bye bye.